Cardiovascular disease has two broad origins. The first origin traditionally has been from infectious disease, and most patients in Africa, maybe 15 or 20 years ago, were plagued with a condition called rheumatic heart disease, which occurred after an infection in your childhood or teenage years. More recently, however, we've facing the second plague of non-communicable diseases, urbanization, diabetes, high blood pressure, obesity and smoking, amongst other things, are exposing Africans to more worrying conditions. Amongst these, what is expected to be the biggest killer in Africa is coronary artery disease by the year 2030. Coronary artery disease is a condition that causes heart attacks, and we're already seeing a significant rise in the number of patients who are presenting to hospital not with rheumatic heart disease but now presenting with heart attacks and conditions related to that. Heart attacks and strokes combined are a big concern, and they have very similar presenting features. The approach to management may be different, but in many ways there's lots of similarities. No, I think be vigilant without necessarily being scared. If you look after yourself and are sensible, then you may be able to avoid problems in the future. I guess it's the same as people being concerned about crossing the road. Of course, many people will run into problems with road traffic accidents, but it doesn't. We don't recommend that people should avoid roads and be super cautious. Nonetheless, there's some things that are sensible. When you cross a road, you look right and then you look left and then you cross the road. And again, if you're trying to avoid problems with the heart, then there are things that we know that you can do to try and protect yourself. Exercising regularly is a good idea. Eating healthily, avoiding obesity by combining your diet and exercise initiatives are the first steps. Avoiding things that put people at risk of heart attacks, including cigarette smoking and a stressful lifestyle, are alternative things that you can consider doing. On top of that, there's some telltale warnings that some people will get. The first thing that they did in Europe to try and manage the risk of heart attacks and to try and protect people from death following a heart attack was to talk about heart attack symptoms. If you present and you have pain in the chest and it lasts more than 20 or 30 minutes, if it's associated with sweating, if you feel dizzy or breathless at the same time, and if it's unusual, then you may be suffering a heart attack, particularly if you've found yourself in one of the risk factor groups. If you're in that kind of scenario, then it's very important to realize that you need to get yourself into a hospital relatively quickly to get it checked out. Now, the truth is, many patients will come to hospital with these symptoms, and there won't be necessarily a problem as sinister as a heart attack. It could be something much milder. However, a significant number of patients who do have these symptoms will be suffering a heart attack, and it is important to be vigilant and to respond to the symptom until you're absolutely comfortable that there's nothing serious. The first thing is everybody's at risk. There are some patients who have no diabetes, have never smoked, have exercised regularly, have been very healthy, and their total cholesterol in their blood is found to be normal. And some of these people can have a heart attack. And more often than not, people with higher risk prediction will suffer a heart attack. Amongst those people will be people with diabetes, people who smoke, people who have high blood pressure. Men tend to be at a higher risk, but it doesn't mean that women are not at risk. Above the age of 40, the risk increases with each year of life. So as you grow older, the risk becomes higher. But we're seeing that many people in Africa are suffering heart attacks at a younger age. I've treated patients in their 20s with proper heart attacks, and so there isn't anything that completely disqualifies you, although it's extremely rare to have a conventional heart attack below the age of 20.